Oh.
Now, if you're lucky, you could hack through your ankle in 5 minutes.
What? Backseat blood transfusions, aggressive ankle bracelets, and whatever you do, don't trust this doctor. Today, we are breaking down and reacting to all the apocalyptic medical scenes and survival injuries from Mad Max.
What a lovely day!
Let's dive right in. Oh, this is like old school Mad Max.
I just come down here to check it out, then. There's nothing you can do for it.
Ankle.
Some kind of bad people. I'm not responsible.
He's got a bandage on his left knee. What could that be? Probably a scrape, but the things you worry about medially on a knee, right? So medially meaning like to the inside is your medial collateral ligament as well as your medial meniscus deep into the knee.
The chain in those hand cuts is high tensile steel. It'll take you 10 minutes to hack through it with this.
Oh.
Now, if you're lucky, you could hack through your ankle in 5 minutes.
What? Could you actually do that? You could. It'd be obviously extremely painful.
It would be extremely painful.
You have to cut through the tissue. You're gonna have bleeding. You're gonna have a lot of pain cutting through the nerves, and then you get to the bone. How quick can you get through the bone? The bone is really hard.
You're bad, man. You think I look silly, don't you?
With the bandage to his left leg, it almost looks like there's a metal piece on the lateral aspect, almost acting like a splint to keep his leg straight. We actually have the same devices in the emergency department, but we actually have two metal rods that go on each side of a knee immobilizer is what we call it. What? Car eventually explodes from the type of potential combustion, that sort of thing. Don't know if it's actually real. I know gasoline goes on fire when it's lit on fire, but then doesn't cause an explosion. It's probably related to other things that are involved. That gentleman, if he's right there in that large of an explosion, obviously is not sustainable with life.
Why is she making that noise?
She's pumping air into her chest cavity. She's collapsing her lungs.
Oh, very cool. There must be a lung injury, chest wall injury. You have a hole in your lung. So every time you take that big deep breath in, it's pushing air out of the lung into the chest wall cavity, which inadvertently is putting pressure on the lung, causing it to collapse down.
I know. I am so sorry.
Oh. So that's what he did, what we do, kind of. So temporarily fix the problem by puncturing a hole through the chest wall going into that cavity where the air is filling up into to release the pressure to allow the lung to re-expand.
She's exsanguinated, drained all her blood.
What are we doing? Oh, we got a big needle. Attempting to do any medical procedure in a high-stressed environment can get your adrenaline pumping. Sometimes I need to wind down, and that's why I formulated Chillax right here. If you want to help combat life's occasional stresses, try Chillax. It's available at lifehappens.com and find us on Amazon. Where are we draining the blood from? Oh, yeah. Ah, we're getting a blood transfusion going on. Could this actually work? It potentially could. Obviously, we're not sanitary here. Here in modern medicine, if there's any concern for infection, you can give prophylactic antibiotics. They did a good job of changing her skin color in the sense of when somebody is very sick, hypovolemic shock, you have this like dusky color to you, gray, really pale.
We take my blood bag. We take my blood bag and strap it into the Lance's perch. It's got a muzzle on it. It's a raging feral. That's right.
Max is upside down.
Upside down.
And he's got a catheter, an IV, draining his blood, hence upside down, in most likely the jugular vein.
High octane crazy blood filling me up.
Oh, look at that guy's face.
What's wrong with your face?
Bad lacerations to the face and really poor repair as well. So you have like big gaping holes to where the scarring is. That basically means that the cut was never actually closed. Well, we got a pregnant individual. Never assume. You never know. This could be a tumor.
It's not a tumor.
This could be something else. You just ask, hey, what's going on? What's going on there? But I've seen this film before, and you can tell by the way the individual's holding the abdomen. Oh! High-speed car accident where you get thrown. A lot of injuries happen. Multiple fractures to the body, blood loss, and brain damage. Oh, looks like we have a pseudo kind of doctor here using a stethoscope, but it almost looks like a trumpet. It looks like one of those old ear horns, but the idea is to try to listen to fetal heart tones. So you're trying to hear the baby's heartbeat.
It's going awful quiet in there.
Get it out. Get it out.
Oh, this is an emergent C-section. Sometimes we'll also call these a peri-mortem C-section, meaning if the carrier of the baby, aka the mom, is dying or did die, you want to get the baby out because the baby still has a chance. Oh, we got a foot.
Another month? Could have been your viable human.
Typically, you do some sort of resuscitation, chest compressions, and breathing for this individual. If you have no heartbeat, no pulse. If they're not breathing, obviously you're going to clear their airway.
Perfect in every way.
I don't know why he cut the cord in such a weird way. Typically, you don't necessarily need to cut the cord. You can clamp the cord and do just fine. At that point, you're just clamping the cord just so the blood flow stops between the placenta and the baby at that point. Hold those kids' legs. Oh my gosh! Fractured nose, and then looks like a bunch of soft tissue injuries to the face. Most of the time, somebody comes to the emergency department with facial trauma like that. We're just gonna clean the wounds, see where all the blood's coming from. Obviously, update your tetanus shot if you need it updated. His left eye is swollen shut, most likely due to trauma and swelling. The eyelids do swell pretty easily when you have trauma to them. Eventually will reabsorb on their own, and then obviously a laceration to the left forehead as well. Wash it out really good. Even washing it out will actually slow down the bleeding. Whoa. I have some things to say about it. Not restraint with open windows. You're gonna have debris flying in there. You potentially will be thrown from the vehicle. Obviously the other vehicle is just demolished. They're probably just in pieces at this point. Oh my gosh. When you have these type of accidents, you get thrown around within the vehicle and a lot of trauma and injuries happen. Fractured vertebrae, intracranial bleeding. I've seen really bad cases where individuals are not in the appropriate restraints and they get tossed around in the car and they die. I am a big fan of the Mad Max movies. They do have a lot of injuries and a lot of interesting medical scenes in them. So if you guys enjoyed my reaction to Mad Max and you want to see more, let me know in the comments. And then obviously binge watch this playlist right here. And make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.